for all medications, it's important to take them as directed. Your doctor will know what they're being used for and how you should be taking them, and you should be listening to that. Especially in gout, there's some confusion about which medications are used for pain. Other medications are used for lowering uric acid, and both of them are very important for the overall treatment of gout. Problem is that if you confuse them and you're not taking them for the appropriate reasons, your gout could get worse over time. There are a number of medications that people with gout take in the face of the acute painful flares of gout. These include colchicine, the nonsteroidal anti-inflammatory drugs, as well as forms of corticosteroids, also known as prednisone or Medrol. All of these are effective, and they are more effective if they're taken as soon after the onset of the flare as possible. They can be used typically for 5 to 7 days, because that's the usual duration of a flare. The most important part of treating gout is eventually lowering the uric acid. Gout is caused by an accumulation of uric acid around the body, and in order to get over the symptoms of gout and to prevent its destruction, you will need to go on uric acid lowering therapy at some time. There are other drugs that have been recently approved by the FDA if your gout is far worse, if you have big accumulations of uric acid around the body. A new drug, pegloticase, is also very helpful in lowering uric acid levels. However, there are a number of other drugs that are being looked at the FDA and may become available over the next year or two. These are all going to be important because a number of patients can't take one or the other of currently available drugs, and the more medications that we have to help lower uric acid as well as to treat the pain of gout, the better off we'll be in being able to get therapy to everybody with gout.